owed to the fund.
Eten migao mar omenda John Badi koro gikone pedho budget manyiso ni migao mar somo moyudo pok maduong. Budget makamano nyiso ni sekta mar somo emano bido pok mamalo mokalo moingo sectors duto. Sekta no nigi pok maromo shillings billion 702.1 migeno ni biro konyo bero sekta no. Migao mar thieth bende oketne billion 138.1 matayo chenro mag thieth ne oganda.
Mr. Speaker, access to quality and affordable health care through the universal health coverage program is central to this government. Towards this end, Mr. Speaker, I have proposed an allocation of Kenya shillings 138.1 billion, up from 123 billion in the current year's budget, to the health sector to support various activities and programs. This includes 6.2 billion for universal health coverage, coordination and management, 13.1 billion for primary health care, and that is up from 7.1 billion in the current year, and 430 million to provide medical cover for the orphans, elderly, and disabled persons in our society. Mr. Speaker, to lower cases of HIV, AIDS, malaria, and tuberculosis, and enhance vaccines and immunization program in the country, I have proposed 17.3 billion for the Global Fund and Kenya shillings 4.6 billion for vaccines and immunization programs, respectively.
Eten migao mar omenda John Badi pedho budget mari komenda mar 2020